gynecologist working in Ankura Hospital for Women and Children, Bodipal branch. Today I will be talking about how often a woman needs to meet a gynecologist. So after 11 years, any woman may need a gynec consultation, and any girl between the ages of 11 to 15 years is recommended for a general reproductive health checkup, because initially when the girl starts her periods, it is better that she goes for a checkup, and she needs counseling about how her periods are going to be, what to expect, and all the pubertal changes that she is going to experience. And also during the initial periods, there can be so many disturbances for which she can be counseled, and during this age of 11 to 15 years, we need to screen her for HPV virus infection, that is human papilloma virus infection, and give her the vaccination. And the ACOG recommends annual checkup for any woman who is sexually active. So any woman who is sexually active, annual checkups are recommended, and during these annual checkups, the gynec examination is done. So gynec examination includes mainly the breast examination, the per abdomen examination, per speculum examination, and the per vaginal examination. In the breast examination, the woman is taught both self breast examination and how she has to examine the breast at home and report whenever she feels any lumps in the breast or any discharge from the nipple. Next that is examined is the abdomen. The abdomen is palpated for any obvious masses or lumps. In the per speculum or the speculum examination, we look for the vaginal walls and the cervix. We look for any infections, any discharges, masses or erosions that can be present in the cervix. And in the speculum examination only, that is how we can do the pap test also. The last would be the per vaginal examination, where it is done to assess the uterus, cervix and the echinacea. After the gynec examination, the next part in the annual checkup would be, after the examination, would be the screening. So the screening is basically the woman is screened for the cancer cervix, then for sexually transmitted diseases, and also for metabolic diseases like diabetes mellitus, hypertension, thyroid disorders, and heart disease. The next part of the visit would be the counseling part. She is counseled about lifestyle changes, diet, exercise, and also she is inquired about any habits like smoking, drinking, and she is educated about the harmful effects of these addictions. The last part would be the vaccination. So vaccination that is recommended for all adult women are mainly it is the influenza vaccine, which is recommended for all adults, especially in the month of October. Then the other vaccines that are recommended are the HPV vaccine, that is the vaccine for the cancer cervix, which is basically of 3 doses, 0, 1 and 6 months apart. Then the next vaccine is the vaccine for hepatitis A and hepatitis B. And the other vaccines that are recommended are first the woman is screened for rubella infection. If she is found the antibodies are positive, then she is already immune. But if the antibodies are negative, that means she is not immune. She is advised 1 dose of MMR vaccine. And patients are also advised Tdap vaccine, especially in pregnancy between 28 to 36 weeks. And the last but not the least vaccine that we are all recommending is the COVID vaccine after the COVID pandemic. So these are the things that a woman should expect in a gynec examination or a annual gynec checkup. That is the gynec examination, the counseling part, the screening part, and the immunization. Thank you.